Hi, I'm Heron with the Speech, Language, and Hearing Center at University of Oregon, coming to you from the floor. And in this video, I want to talk just a little bit about what speech therapy can do for you, what the value of speech therapy is in the process of voice masculinization and feminization. So the first thing that I want to mention is that the research is not as broad or as deep as we would like, and that's an unfortunate fact, but we do know a fair bit. We know what parameters, what types of things about the voice you want to change in order for your voice to be gendered differently. We've talked about that in other videos before. It includes pitch, intonation, vocal quality, resonance is a really big one. And we know also that you can change those through your behavioral training alone, right? Exclusively through creating new habits, you can affect those parameters about your voice. And that's not to say that your anatomy doesn't matter at all. There are, of course, anatomical underpinnings that affect how your voice sounds. The thing is, we can use our muscles and retrain ourselves to adjust how we use the anatomy that we have in a way that creates an effect that is similar to if our anatomy were different. That's also not to say that medical intervention can't be valuable. For transmasculine speakers, you often find that testosterone goes a really long way towards achieving the kind of voice that you want. And indeed, for some, testosterone on its own might be sufficient. Of course, other times there are some transmasc speakers who want to further modify their voice, and that's where that behavioral piece comes in. For trans feminine speakers, we do have laryngeal surgeries that can affect the way that your pitch is and the way that your voice sounds, but it does not create that full comprehensive holistic change that we want. It does have to be accompanied by those behavioral changes. The value in having a speech therapist in this process is at least twofold. A clinician will have a lot of knowledge about how the voice is produced and how to elicit various sounds. They'll help you explore your voice. Additionally, a clinician will be able to give you direct feedback as somebody else, as an external source of somebody who knows what to listen for and who can provide a second opinion about your voice. We hear our voices really differently than how other people hear our voice. And even if you're listening to recordings of yourself, it can get to be a lot over a period of time. You sort of stop hearing what you want to hear about your own voice. So you get that feedback, and those things are both really valuable. You can voice train without a clinician. You can do it without a professional. That's what I've been doing so far, but your mileage may vary, right? I personally am really proud of the progress that I've made so far, but I can feel myself starting to plateau. And there are times when I've gone to online forums to post my voice and get individualized feedback. And during those times, it has been extremely helpful. I've made more progress on single days when I've made those sorts of advice posts than some months when I'm just doing it by myself and listening to myself. Yes, you can do things on your own, and that's really good and really valuable. And also, working with a professional who knows how to help you explore your voice and how to listen correctly is going to be very helpful as well. Finally, the last thing that I want to talk about is supporting different kinds of voice goals. For example, some people, myself included actually, are interested in supporting a bimodal voice. That is to say, using, for instance, a femme voice sometimes and a masculine voice at other times. And the research on this is really unclear. Does that work? The point, again, is that we're trying to create habitual change. It's hard to build habits when you're not doing the same thing all the time. But we know that people can cultivate a singing voice that's different from their speaking voice. And we know that people can speak multiple languages and dialects and that they can code switch between these. And so it's not unreasonable to think that at least some people can have more than one voice that they use on a regular basis. The point is that if you have particular voice goals, really whatever they are, however standard or non-standard, any therapist worth their salt should help you work towards those goals and should keep them in mind as they work with you.